Hello and welcome. Let's talk about endoscopy. Indications of upper GI endoscopy. Diagnostic and therapeutic. Diagnostic includes peptic ulcer disease, carcinoma of the stomach, achalagia cardia, carcinoma of esophagus, Barrett's esophagus, GERD, familial adenomatous polyposis, Peutz-Jeghers syndrome, and the therapeutic includes ligation of bleeding vessels and injection sclerotherapy. Now, information that can be obtained from upper GI endoscopy. Here are the informations you can note from here. Now, indications for single or double balloon endoscopy. The bleeding from the GIT of obscure cuts, iron deficiency anemia with normal colonoscopy and gastroscopy, visualization and therapeutic intervention for abnormalities seen on traditional small bowel imaging. Now, therapeutic endoscopy. Therapeutic endoscopy means the treatment done by endoscopic procedure. Examples like ligation of the bleeding vessels in upper GI bleeding, injection sclerotherapy in gastric bleeding, dilatation of benign esophageal stricture, dilatation of pyloric stricture, intractable disease which can be treated by the insertion of a removable stent, and tightening of the loose gastroesophageal junction in case of the GERD. Now, disinfection of the endoscopes. All channels must be brushed and irrigated throughout the disinfection process. All instruments and accessories should be traceable to each huge patient and cleaning cycle. All steps will be trained and protected, particularly if glutaraldehyde is used in view of its immune sensitizing properties, and regular monitoring of the disinfectant power and microbiological contamination should be performed. Now, risks of endoscopy. Sedation, damage to dentition, aspiration, perforation or hemorrhage after endoscopic dilatation, perforation, infection and aspiration after percutaneous endoscopic gastrostomy insertion, perforation or hemorrhage after flexible sigmoidoscopy or colonoscopy with polypectomy, pancreatitis, cholangitis, perforation or bleeding after ERCP. End of the topic.